My Life and Pain, submitted to the Chronic Pain Association of Canada by an anonymous Canadian pain patient, April 2020. I fear the system more than the disease, is what I told my family and friends after being diagnosed with breast cancer in early 2018 while I was in my 30s. Unfortunately, I was right, and this concept of the system holds true to me today more than ever. Over a decade ago, I had a severe accident that I luckily recovered from slowly, but was left with chronic and excruciating headaches. I have had trouble sleeping, eating, working, or doing schoolwork. I was a graduate student at the time. I felt like I consistently had a toddler standing on my head, sometimes as though I was being electrocuted. Other times it was like being hit in the head with a crowbar. The pain would get so intense, my eye would water and close up. Other times it was so intense it made me vomit. And severe pain seems to have a way of making you feel either completely helpless and hopeless or incredibly angry. And this was not good for relationships of any sort. Fortunately, I found a doctor who at first prescribed codeine phosphate and eventually switched this to morphine sulfate. I resumed my life and function. I finished graduate school while running a business, moved across the country, started a new business, and eventually bought a house in the country. But now my new doctor, who had resumed the prescription, retired. He sent me to a pain clinic, I had already been to two, to help me to get by until finding a new family physician. However, this clinic was a 3-hour drive, and I had to visit weekly, which wreaked havoc on my business travel, amongst other things. And it was more like a back alley drug deal than a clinic or a place of healing. Enter, show health card, pee in a cup, receive prescription, return next week. 6 hours of driving weekly for a 5-minute appointment seemed ridiculous. But this was the beginning of the quote opioid crisis, a fandangled term that has seen chronic pain patients become the greatest casualty. When I finally got a new family doctor, after being on a wait list for over a year, I was immediately treated as a drug seeker, aka anyone that presents with chronic pain as their only or any condition. I am fine with giving urine samples if you are prescribing a regulated substance, but I was accused of everything from not providing a urine sample when they lost one, to taking drugs I had not taken as a result of morphine metabolites and impurities. Every time I visited this physician, my blood pressure would shoot through the roof with the anxiety of thinking, what will I be falsely accused of this time? A doctor's appointment should not be about defending yourself, but about treating and healing what ails you. My morphine dosage was immediately and abruptly reduced by 25%. Not only could I no longer manage the pain, but I also suffered from symptoms of withdrawal. As I explained, the doctor agreed to taper more slowly, but provided no additional or alternative pain management options. And the only thing offered to help with withdrawal symptoms made me pass out from low blood pressure. There was no mutual trust in the patient-doctor relationship. It seems as though chronic pain patients are now viewed as simply seeking their next fix, and that we just cannot be trusted in any respect. So, in my frustration, I fired my doctor and decided to go cold turkey on my own rather than suffer months of withdrawal from the tapering regime. It was a very rough time. I didn't sleep for 9 days, which was the worst part, but I did it. However, I still needed to somehow manage my pain. 3 weeks after stopping the morphine prescription is when I suddenly found my very large and aggressive breast tumor that hadn't been there 2 weeks prior. I was eventually diagnosed with triple-negative breast cancer, meaning that the cancer cells don't have any of the 3 usual hormone receptors and therefore will not respond to hormone therapy. Basically, the only treatment offered is chemotherapy and radiation, both of which I denied, but I did have a mastectomy. What I learned from my research is that there are other receptors for breast cancer that we don't test for, one being an opioid receptor. In some types of cancers, opioids can actually shrink tumors, although there is mixed evidence to be sure. Is it possible that my fast abandonment of the very medicine that was allowing me to function gave me a potentially deadly and lifelong illness? I'll never know, as we don't test for that. To manage my pain and possibly some of the stress the system induced, I began purchasing Tylenol 1s over the counter and taking them with vodka so that they would work. This regime was not as effective as morphine, but it was all I had to work with my near empty toolbox. To top it off, I had no family doctor, in addition to chronic pain and cancer. When I did find a general physician, about 2 weeks before my mastectomy, they suggested that I not be prescribed opiates for recovery after surgery. Pardon me? I may have said something along the lines of, "Let me chop off a part of your body and see how you feel," which is snarkily similar to my response to the practice of mindfulness if you need to run a marathon after being shot in the foot. But in the eyes of our healthcare system, because I displayed with chronic pain, I must have just been doctor shopping, pill seeking, and have a substance use disorder. Luckily, my surgeon was not that cruel and did prescribe enough opiate medicines for recovery. I recovered from cancer, but still had chronic pain, so I kept drinking alcohol and taking Tylenol 1s, which are the only tools I had to work with. As a result, I now have a fatty liver and gave myself peripheral neuropathy, an extremely painful condition. Ironically, in an effort to self-manage the pain I had been dealing with for a decade, I gave myself a condition that is even more debilitating at times. Now, I am still not prescribed anything for pain management. I am allergic to the seemingly unproven and largely ineffective antidepressants and anticonvulsants that are all the rage, and I have been denied any pharmacological treatment that would allow me to stop drinking. Because I am now classified as an addict, there is no way they will ever prescribe me with something that could be habit-forming, even for a week, and even if it would keep me alive and allow me to stop drinking to relieve pain. However, there is a difference between addiction and dependency, now largely recognized in the scientific literature, but something that doctors and addiction counselors don't seem to understand. We become addicted to things that don't help us, but destroy us in the end. We become dependent on things we use for function, including a biological or physical dependency. If you have a condition that will last a lifetime, does it matter whether you are dependent on the treatment? It doesn't seem to matter with other things that are prescribed for other conditions. So, in the midst of this opioid crisis, I have had my own crises. Luckily, I have been able to reverse much of the neuropathy, but still, all my pleas for assistance with pain management have fallen on deaf ears in the medical community. So as a result, I self-medicate and manage my pain as little as possible with street drugs, which of course are much less safe than something medically prescribed and regulated. I am also working on detoxing at home, but again, I'm not sure how I will manage the pain or the symptoms. And in this crazy world we now live in, medical attention is even harder to find. On many days, the neuropathic pain leaves me unable to walk and wanting to chop off my feet. But it won't go away until I stop drinking alcohol for the other pain, and so the vicious cycle continues. The system has been one large frustration for me. Not everyone is the same, and we should all be treated as individuals. There are also some ways that I don't think anyone should ever be treated, such as being forced to give a urine sample under closed-circuit television to see a doctor that is not going to treat you. It's all very humiliating, stressful, and very far from the healing that is supposed to be the purpose of medicine. We're not only stigmatized, but we're also abandoned. The blame put on chronic pain patients for a crisis that involved recreational drug users put us at greater risk of suicide and overdose from street drugs of unknown purity and makeup. However, some of us are left with no choice but to seek out street drugs should we wish to maintain any function. We, those with chronic pain, are not the cause, but the casualty of the opioid crisis. And I, unfortunately, don't see any end in sight, particularly in this time of lockdown and uncertainty.